Hello, this is Dr. Eric Bricker, and thank you for watching AHealthcareZ. Today we're going to talk about cardiologists at conferences and the effect on better outcomes. So this comes from two studies by a Dr. Anupam Jena at Harvard Medical School. And I just want to tell you, this guy is awesome. He is such a prolific researcher, and he researches such interesting topics. I'm going to leave a link to his profile in the notes of this video. I mean, check him out. Like, he's not a household name, but he should be. Now, he did a fascinating study. In fact, he did two fascinating studies that were about what happens to patients and their heart care when the large number of cardiologists go to conferences. So it's kind of a joke where people would say at the conference, oh, this would be a great place to have a heart attack because you have a gazillion cardiologists around. Likewise, back at the hospital where you have the junior physicians and the residents, and the people at the hospital would be like, this is really not a good time to have a heart attack because all the cardiologists are at the conference, okay? And it's like a cardiologist ghost town at the hospital, okay? Now, but what do the facts bear out? Well, that's what Dr. Jena looked at. He said, okay, well, what happens for, in a study in 2015, what happens for things like congestive heart failure and sudden cardiac arrest? And in another study in 2018, what specifically happens for heart attacks? Do people do worse? Do people do better? And guess what he found? That patients did slightly better. There were slightly better patient outcomes when all of the cardiologists were at the conferences. So in other words, when the cardiologists were away, it was better. Not a lot better, but slightly better, okay? Specifically for CHF and cardiac arrest, and specifically for myocardial infarctions, which is a heart attack, the 30-day mortality when all the cardiologists were at a conference was 15.3%, and then when the cardiologists were like back at the hospital, they were 16.7%. And part of the reason for that is hypothesized by the article is because when the more senior cardiologists, in this case interventional cardiologists that actually do stentings to unblock the arteries during a heart attack, that they're just more aggressive and people just get more procedures. So actually, when the cardiologists were away, the patients kind of had less done to them. And guess what? When they had less done to them, they actually did better. And then when the cardiologists came back and they had more aggressive therapy, they kind of did a little worse. And I would just tell you that anecdotally, I would be wary of physicians that I worked with at the hospital when they say, oh, we're going to aggressively, I'm a very aggressive doctor, I aggressively, treat such and such disease. And I'm like, well, it depends. I mean, sometimes it's good to be aggressive, but sometimes it's good not to be. Like constant aggression is not always a good thing. Okay, and so what's my point for today is that we as physicians, we just need to understand, you know what, we're not the end-all be-all, and we're really not that hot, okay? So we need to get part of excellent, high-quality care is, honestly, it has something to do with the pride of the physician. And to the extent that they don't have a lot of pride, and they have a lot of humility, then that's one of the characteristics that I look for in a physician for myself or for my family members. And in the physicians that I learned from, it was really the humble physicians that were the greatest physicians. And I will tell you, I trained under the cardiologist at Johns Hopkins Hospital in the cardiac ICU, and like Dr. Steve Schulman and Dr. David Team, I mean, these are incredibly humble people. They were geniuses, but they were like, they admitted to themselves, they're like, you know what? Sometimes you don't know. And so rather than aggressively going after something that they weren't sure about, sometimes they would wait. And so that's my point for today is when we're talking to doctors, when we're as physicians talking with our colleagues, it's important for all of us to get a good dose of humility when it comes to patient care. And thank you for watching AHealthcareZ.